All right, so we're going to be going over our moderate sedation competency, okay? So when we do moderate sedation in the OR, the main cases we're going to be doing are pacemakers. That could also include a regenerator changes, okay? So when we do those, no anesthesia is involved at all. So some of the pre-step that we don't ever see is not being completed. So one of the things that needs to be done is making sure before you come back with these patients, your pre-induction sedation assessment form is filled out. Now, we are not qualified to fill these out.
Okay.
The surgeon has to be the one to do it because their Mallampati score and their ASA is assigned by them. Again, we're not qualified to do this, but just make sure that it is on the chart before you roll back. Okay? If not, perfect, serve them, make them come do it.
Okay.
All right, next. So our two drugs that we're going to be given while we do these cases are what?
It would be fentanyl and Versed.
And what's our antagonist for fentanyl?
Narcan,
And for Versed?
Clonazepam,
Or?
Romazepam.
Okay, perfect. And both of those antagonists are kept in the top drawer of the blue belt if you were to need them.
Okay.
Okay. The other things that are kept in there that we can use if we have to, there are some blood pressure medications to lower blood pressure. Now, if you need to raise blood pressure, you probably need to be calling anesthesia.
Okay.
Okay. Because the patient's getting pretty critical at that point. Now, when we come in here to do these cases, we're going to go ahead and have a move over to the table. We're going to hook them up to our monitor, like we've always done, blood pressure, heart, and pulse ox. The only new thing that we are going to start doing is we're going to just go ahead and put them on a face mask for oxygen. You can do this with a nasal cannula, but this is probably just the easier route, more comfortable. So we're going to have a face mask, and we're going to make sure there is the gas sampling line, okay? And so this, we're going to have it, I found the easiest way is when they have the mask on, wrap this around the little green string that comes to the side and just stick it up underneath, kind of close to their mouth and nose. And then we're going to take it and we're going to hook the other one in right here. Okay. So some of them it's here, some of them it's up on the monitor, so just making sure you know, like when you go in there, which one to put it on. Okay. So when we get this hooked on here, what we're going to do with the so we're going to do vitals how often?
Every 5 minutes.
Every 5 minutes for the whole case, correct? All right. Now the thing, we're actually going to be able to touch this part of the monitor now. So we're going to go to start case. We're going to go to start case now. Okay. And then we're going to go to, where is it? Procedures. And we're going to start cardiac bypass. What are we doing when we do this?
Are you getting the CO?
So this will be reading our end title, this screen.
Yeah.
Yes. The reason we have to start cardiac bypass is to keep the thing silent.
Okay.
If not, it'll alarm the whole time. And nobody wants to hear that.
Okay.
So I'm just going to end case. Stop cardiac bypass. It close. End case.
Oh, so I can just do that.
So if you need to, I would just plug this up into the oxygen flow.
Okay.
And you can back up until anesthesia can get here.
Okay.
But obviously, if you need to start bagging somebody, you need to be called for
Yeah.
anesthesia.
Yeah.
So,
Okay.
okay?
Yep.